You are welcome to my channel. Thanks for visiting. Today is all about rabies, and I want you to join me in the campaign against the senseless death due to rabies. We are all familiar with the name. You need all the facts about this agent that has caused senseless deaths in both animals and human beings. This shouldn't be killing anyone anymore. Close to 60,000 people still die annually due to rabies. It is more in places without the rules and regulations as per immunization of pets. However, even in countries with rules and regulations as per immunization of pets, you can still have rabies from the wild. Remember to share this later on when you're done, and remember to subscribe to my channel. Your focus will soon change after this presentation because almost all of us would have blamed dogs for rabies, but you will soon know that cats, birds, raccoons, foxes, skunks, ferns, woodchucks, and more could be responsible for rabies. Thanks for listening. Without further ado, let's go. Since you have visited my channel, then don't let us play game with our lives. Lives of everyone associated with us or those under our watch. To almost all the infected people with signs and symptoms of rabies, it is death sentence. In other words, no treatment, no cure. So this presentation is pretty important to make sure we don't have rabies infection, because if we do, we are going to die. I said negligible recoveries because there is no literature you can search. Anyone, any human being with signs and symptoms of rabies is doomed to die. Only 7 recoveries have been recorded in the last 30 years. Even those 7 cases, no rabies virus was isolated in those 7 patients. But they were able to pick high rabies neutralizing antibody titer in the serum of the affected individual and also in the cerebrospinal fluid. So the experts put it together that if they could pick the antibodies in the serum and cerebrospinal fluid, then they strongly believe that they must have been previously infected by rabies virus. So it was an hypothesis that, oh, if that is what we got, then this must have happened before. Rabies virus itself was not picked. In other words, we are not even 100% certain that they actually passed through this, one way or the other. So who knows? But as of today, once we have signs and symptoms, it's like call your lawyer quickly, write your will. You are going to die, according to our books. But go through this presentation and see how that may not happen due to rabies virus. How do we define rabies correctly? In English dictionaries, if you are searching for the meaning of rabies, you get something like it is a contagious disease that is fatal and that it is being spread from animals to humans. And they will also tell you that it could lead to madness, convulsion, and it is from the saliva of the animals. That is what you get from English dictionary. But medically, as a physician, we will tell you that it is a viral disease, zoonotic in the sense that it is from animals to human beings. And we will tell you further that it is going to cause a fatal condition, meaning once human beings start manifesting the signs and symptoms of rabies, then it is the death sentence. But not only human beings that could die once the signs and symptoms start showing up, even animals. Any animal that's already manifesting rabies is going to die. We will also tell you that it's going to be affecting the central nervous system, that is the brain and the spinal cord. The rabies could be furious rabies and it could be paralytic. Someone will ask, how do you mean? Don't worry, we're going to die. Death is almost certain. So, by that, we've all gotten the green light that this is a senseless death. Anyone with signs and symptoms, even animals with signs and symptoms of rabies, is going to die. I've been talking about disease is fatal, Yeah, that is pretty huge. 99 to 100% of the animal or human being showing the signs and symptoms will die. Some will say, why the 1%? I'll talk about that later on. Because majority will know that 100% would die. Prevention is cheaper than this incurable condition. Then we'll examine what to do not to die. Educate yourself today and educate everyone around you. My brand is purposely to reduce pain, suffering, and preventable deaths. That's why I'm here. So let's begin. Let me quickly share some true life stories with you right here about rabies. The sad one was about a young man aged 16. Handsome, smart, loving young man. He was bitten by the dog of his neighbor. He went straight to tell the mom. The committed and concerned mother took him right away the same night to see their family physician. Family physician took history whether the dog was mad or not. The answer was the dog wasn't mad. Then he gave the young man tetanus toxoid and sent him home. Life continued. But that happened in October 1990. 3 months after, that was December 1990, the young man started manifesting signs and symptoms of rabies infection. He was taken back to the same physician who referred him to the tertiary institution, University Teaching Hospital. By December 24, Christmas Eve of the same year, 3 months after being bitten, the young man died of rabies infection. Some people are alive today after being bitten by dog, cat, or bat because either they've gotten pre-exposure prophylaxis or they presented to their physicians early enough and they got post-exposure prophylaxis. Many of them would have died later on in life due to other causes, not rabies infection. No. There was an argument in the month of September between two physicians. I was called by someone to give my opinion. An individual was bitten by a dog, the vaccination status of the dog not known, and the affected individual said a physician. This happened in another continent entirely. So the first physician gave 1 dose of post-exposure rabies vaccine and said that was all. They sought the opinion of another physician who disagreed and said 1 dose will not suffice. I was contacted to give my opinion, and I told them, if the affected individual had not been previously vaccinated, because you are not a microbiologist, you are not working in veterinary clinic, you are not dealing with wildlife, you are not animal handler. If you have not been vaccinated before, you need immunoglobulin today and 4 doses of the vaccine as day 0, day 3, day 7, day 14, if you are immunocompetent. If you are not immunocompetent, meaning you are immunocompromised, you will come back again for another 1 shot on 21st or 28th, day 21 or day 28. The dangerous constitutive agent here is a virus. So, rabies virus, right? Belongs to the family of virus known as Rhabdoviridae and of the genus Lyssavirus. By way of description, it is a single-stranded rod or bullet-shaped ribonucleic acid virus, RNA virus. It encodes about 5 proteins in its genome. Campaign against rabies. Like what I'm doing now, please join in campaigning against senseless deaths due to rabies. The World Health Organization is the leader. As a matter of fact, if you don't know, get the fact right now that World Rabies Day is September 28th of each year. For the past 17 years, the World Health Organization has been doing that. All regions are trying their best. In some advanced countries like Australia, or countries in Europe, North America, it is compulsory to get your pets vaccinated, particularly dogs, cats, ferrets, some animals that are already known to be able to harbor rabies virus will always be vaccinated. Associated risk factors. Who is at risk? Microbiologists dealing with rabies virus, vet doctors, vet members of staff, residents of the prevailing communities where pets are not mandatorily vaccinated. You receive tissue transplantation that has not been screened for rabies virus and unfortunately is having rabies virus. You are visiting the abode of bats, raccoons, foxes, dogs, pets, and cats. You are traveling to regions known for rabies prevalence, camping in the wild, even in regions known for low level of rabies. You could be attacked and you could be bitten by rabid wild animals. The proximity to the brain when you are bitten is another factor. For example, you have been bitten at the head or neck region. That will let you have the infection faster than someone bitten at the feet. Although there are other factors associated with the incubation period that could be as fast as 5 days or as late as 2 years. And I'll explain all those later on. There are many possible questions, but let me tell you categorically that I have provided answers right here. One of those many questions will be, what happens when rabies is already in human beings? Is it deadly? And if it's not deadly, can it be cured? Can this senseless condition be prevented? How is this being transmitted? Is it through bites or scratch alone that one can contract rabies virus? Are there other ways besides being bitten or scratched by an animal? You can also ask yourself, do I need to be vaccinated against rabies? I have been bitten by an animal. What is next? Which animal should I avoid? Is it only in domestic animals? Can it be in animals in the wild? Is it found in my region? Can travelers be vaccinated against rabies? How many doses of rabies immunoglobulin should I take? How many doses of vaccines do I need? And at what intervals? Any difference between intramuscular and intradermal routes of rabies vaccine? Intradermal and antimalarial agents, is there any problem with that? What if there is vaccine scarcity? Or what if I don't have the money for the vaccine? Must I take the vaccine immediately? What if I couldn't get to the clinic till almost a month after I have been bitten by a dog, bat, or cat with rabies? Can the wound be sutured immediately? What are the signs and symptoms of rabies in human beings? Even in animals, I'll go through. How is the diagnosis being made? When the signs and symptoms are already established, any treatment? Let me just summarize the epidemiology of rabies here. In summary about epidemiology, 1, it is found universally. 2, though it is found universally, some islands in Australia and Antarctica will experience less cases. 3, it is more in some countries. Those countries are not going to be listed, but you will know when you are in a country and there is no mandatory vaccination policy against domestic animals. That is, if there is no law that forces you to vaccinate your dog and cat, then it is likely going to be more in your country. It is going to be less in countries with rules and regulations prohibiting keeping pets, particularly those that can harbor rabies virus without being vaccinated. So the countries that have law against such, the countries that will force you to vaccinate your pets will have less cases. But the countries like Europe, all countries in Europe, countries in North America, that will force you to vaccinate your dogs and cats against rabies will not be immune against rabies. And that's why. Okay, wildlife, animals in the bush might be the source of their own rabies. So it is not a zero case per se in some of these countries, and the few cases they have will likely be from animals from the wildlife. Okay, so it might be through camping, bitten by bat, or on the farmland, or you are living, where there are trees. So about 3 scores of human beings have died due to rabies annually, and they are still dying. And a lot of people have taken vaccines due to post-exposure, and that will be millions, 10 to 20 million annually are taking vaccines post-exposure. So it is a worldwide problem. Transmission is possible between animals to animals and from animals to humans. And once signs and symptoms are manifesting in humans, then death. We will go through all possible preventive measures. But we need to know the meaning of pre-exposure, that is, before having contact with the virus from the saliva of infected animal. Post-exposure means after you have been bitten or scratched, or your open wound had been licked by an animal suspected to be harboring the virus. I've been talking about animals things. Let's go to the list of animals that could transmit rabies, but not limited to this very list. Please, dogs, cats, bats, you are all familiar with that. In addition to that will be skunks, rodents, rabbits, raccoons, foxes, monkey, cows, goats, horses, beavers, ferrets, woodchucks, coyotes, and the list goes on. Find out from the public health officer in your region. Transmission. Transmission is important in preventive measures because we will know how to break the cycle. You might be wondering, you have your animal at home. How could this animal then have rabies? Though there is no law in your country that compels you to vaccinate your animal. Okay, let's go through it. First of all, problem could start from the bush. Wild animals like bats, raccoons, foxes, or skunk could have bitten your dog or cat. Rabies virus in the saliva of the animals I mentioned earlier will be inoculated into the peripheral nervous system of your cat or dog. Through that means, through peripheral nervous system, particularly the motor nerve, the virus will travel to the spinal cord neurons and then get into the spinal cord and multiply rapidly there in the spinal cord neurons. From there, it will go into the brain, affecting the different parts of the brain, and also get into the salivary glands. That is how it will get into the saliva of your own domestic animal. And from that, the infected domestic animal can bite healthy human being. And the same virus that's already in the saliva of your animal will then be inoculated into the human being. The rabies virus will be transmitted into the human being through that means. And sometimes it might not be because you have been bitten. It might be because the animal just scratched you, or you have open wound and the animal has licked that open wound. In that case, any means through which infected saliva is gotten into your body, either even when the saliva in form of aerosol lands on open wound or on mucous membrane in the eye, the mouth, and the nostrils, then inoculation will occur. In fact, could be as a result of inhalation of the aerosol. Okay, so once it gets there, then it's going to find its way to the central nervous system. So we understand that through pathogenesis in a bit. So the mode of transmission mostly is through the bite of healthy animal or healthy human being by rabid wildlife or rabid domestic animal, and it gets into the system of the healthy animal or man. The pathogenesis is essentially that once bitten, scratched, or aerosol landing on mucous membrane, the incubation period will be between 5 days to 2 years. Why no the variation, I will explain in a bit. Mostly, the incubation period will be 1 month to 3 months, but it could be as fast as 5 days and could be as late as 2 years. There are factors determining that. The rabies virus will enter the peripheral nervous system either directly or by dividing in the muscle or anywhere that the inoculation had occurred. The rabies virus will remain there for the time of incubation, 5 days, 1 month, 3 months, or 2 years. If you carry out any investigation around this time, you will get negative outcome. So testing will yield no result during incubation period. The virus will later move from the point of entry to the peripheral nervous system. The division in human beings will take place in the central nervous system. Then, signs and symptoms will begin. Later on, we will understand what prodrome is. Rabies will later pass to other organs, including salivary glands. How do they replicate? Remember that while describing rabies virus, I've stated that they are single-stranded ribonucleic acid virus, RNA virus. The rabies virus will attach to the host cell through G proteins. And by that, they'll be able to penetrate the cytoplasm by fusion. They can also penetrate the cytoplasm by another means, known as pinocytosis. Then the uncoating will follow. The core will set up the primary transcription of the messenger RNA. They will be 5 in number. And they will use the viral-associated RNA-dependent RNA polymerase. Each RNA will then be translated into individual viral protein. The replication of the genome RNA will continue. The full length, which is the positive stranded RNA, will be produced. That will in turn produce progeny negative stranded RNA. Skin bite or scratch, you can see the skin. If the skin is injured, fine. But if there's any cut, then some would determine the degree of the cut. If it's leading to bleeding, meaning it's deep enough to reach this stage, then they will give immunoglobulin. Some will say without that, no immunoglobulin. I will still give immunoglobulin anyways. So scratch or bite to the skin Could be nothing at all or very deep. And this will also determine whether you suture or not. Proximity to the brain could determine how quickly the affected individual can come down with signs and symptoms. Then other factors like immunity, the viral load, and so on. For example, somebody is bitten lower down here compared to someone bitten at the head or neck region. The latter, someone bitten at the neck or head region, will have the virus reaching the brain faster than someone bitten at the feet. When the skin is open wound, or mucous membrane is exposed to the saliva of infected animal, because I don't want to be mentioning dog alone. Not only dog, could be cat, dog, bat, raccoon, ferret, woodchuck, and now the list goes on. Is similar. Open wound on the skin is similar to mucous membrane, the eye, inside the ear, or inhalation into the lungs. Immediately the virus gets into the body of the victim, the target will be the peripheral nervous system. The neuron going to the spinal cord, from spinal cord to the brain. The brain is the target. The whole journey from the skin, the ear, the eyes, the mouth, anywhere, peripheral nervous system is all to get to the brain. All parts of the brain could be affected. And you know what that means. From there, it's going to multiply in large number and affect other parts of the body. Affected glands will be mainly the parotid, somewhere here, the submandibular, and sublingual, below the tongue. Remember, it is all about saliva. Okay, so it's the salivary glands. Parotid, submandibular, and sublingual salivary glands. It will affect all organs, but gastrointestinal tract will pay a price. Nausea, vomiting, diarrhea, and spasm along the gastrointestinal tract. That is why we will run into a term called hydrophobia. Not because the person is afraid of water per se, but the difficulty in swallowing will lead to fear of drinking water or even eating food. As a matter of fact, mere thinking about drinking water could lead to spasm in them. Hydrophobia. Remember, aerosol could be inhaled, and after multiplication in the brain and spreading to all organs, when the lungs are affected, then we are reaching the end of the road. Respiratory failure, respiratory arrest is a possibility. The heart. This is the last buster. Cardiorespiratory arrest, and that means death. Don't need to resuscitate. That is the end of the road. Now, pre-exposure prevention will warrant keeping away from all those animals listed earlier, and more depending on your jurisdiction. Please contact the public health authority in your jurisdiction. Put the animals in good shape. Vaccinate them. If you are keeping pets, keeping dog, cat, ferret, no, if you like, if you keep other dangerous animals, but you've gone through the list, find out from your public health other ones in your country that will have rabies virus, vaccinate. Put yourself in good shape. Vaccination, if you must be dealing with certain animals or your occupation will warrant it. I'll go to that list next. So it's not everyone. Like, I have never been vaccinated against rabies, and I don't really need it because I'm not working in that field. But we'll get to that now. Now, pre-exposure, before you'll be bitten, scratched, licked, or you inhale aerosol of any animal containing rabies virus, then get yourself vaccinated if you belong to one of these. If you're a veterinary doctor, I don't need to advise my colleagues in that field. They do the right thing to do. Sorry for poking nose. And members of staff, you are a microbiologist. Not all microbiologists, but those that will be dealing with rabies virus. Please, before you get exposed, vaccinate yourself. Those that will be working on the production of rabies virus vaccine, you are at risk highly, and I know you will protect yourself. Animal handlers, like there are pets daycare centers. You are keeping dogs, different types of dogs. You have staff working with you or for you. Please protect yourself. Animal protectors. We have problem with certain animal. It might even be a rabid dog that is restless and aggressive around. We call animal protectors to come and get it right. They need protection. They need to be vaccinated. You are a traveler going to endemic regions, and you know that they don't have the laws in that region to protect animals from rabies virus, so they will not vaccinate the animals, or you will be dealing with animals there, or you'll be going, wildlife, whatever, and you are leaving your zone where rabies is low. You are risking it into the zone where rabies is more prevalent. Then get yourself vaccinated now. Frequent and even, let's say, sometimes occasional camping in the wild could warrant vaccination. Remember, I've said in European countries and North America, Australia, some islands there, Antarctica, they don't have the headache much, but apart from Antarctica and some islands in Australia, even North America and Europe, they are not immune to rabies infection, because 90% of cases that will be reported in those advanced countries, even with the legislation and everything on compulsory immunization of the pets, domestic pets, we'll still have some people that will get the rabies virus from wildlife. So if that is the case, if you are camping the bush and you wake up and you've seen dead, what do we call this, bats near you, or you notice a scratch and you don't know what is responsible, I would rather have that vaccination than risking your life. I've been talking about vaccination a lot, but we need to get the correct one, please. The World Health Organization has recommendation about rabies vaccination, and who recommends that we have to discontinue all nerve tissue vaccines, and who encourages the use of modern concentrated and purified cell culture derived vaccines or embryonated egg-based rabies vaccines. That is what they encourage. Now, let's go through some of those vaccines one by one. The RVA simply means rabies vaccine absorbed. That was produced in the United States, precisely in Michigan, in 1988, around March. It is useful for both pre-exposure and post-exposure prophylaxis. It's given through intramuscular route only. The HDCV simply means human diploid cell vaccine, while PVRV simply means purified viral cell rabies vaccine. PCECV simply means purified chick embryo cell vaccine. Remember, World Health Organization has advised embryonated would be good, right? While CPRV means chromatographically purified viral cell rabies vaccine. You may disagree with this list. Please contact the public health officer in your region. Discuss with your pharmacist. Follow the order given by the health authority in your jurisdiction. That will guide as to which of these you can use. Okay, you've gone through who should be vaccinated before exposure. You've gone through the vaccines. You know the one available in your region. Now, how do we give it? Number one, choose the route you want. Through the information on your vaccine, can it be given intramuscularly and intradermally? Because RVA cannot be given intradermally, only intramuscularly. If you have known that, if you are going for intramuscular route, then you can give it the 0, 7, some would then proceed to 21 or 28. If it's intradermal, the 0, 7, 21 or 28. Now the dose will not be the same. Intramuscular route, 1.0 ml. Intradermal route, you reverse it, 0.1 ml. Now, if the person is on antimalarial agent like chloroquine, please no intradermal route, only intramuscular route. Please pause this, rewind again so you get it fast. Confirm from your pharmacist. Public health. Follow the protocol in your jurisdiction. Okay, you've been exposed. Then you've come, we'll take care of your wound. At presentation, no matter how long the exposure has been, there must be wound care. We will use soap and water, and we will use the water copiously. But if for any reasons we don't have the soap, we will continue with water copiously. You can have disinfectants. Some people will use ethanol for that, while some will use iodine. And immunoglobulin, I will address it after, but we can give tetanus here if it is greater than 10 years that you've taken the last tetanus, okay? And some will make use of antibiotics prophylactically. Suturing will be needed if it is occurring at the head and neck or facial region. I mean, if the scratch is deep and is at the head, neck, or facial region, or the bite is at the head, neck, or facial region. But we will always give immunoglobulin infiltration before suturing. If it is not head, neck, or facial region, we can postpone suturing till about 72 hours. Let's check the different categories of bite or scratch and determine whether we will need post-exposure prophylaxis, that is immunoglobulin and vaccines, or not. In category 1, the animal didn't bite. The animal only came around and touched you. Your skin is intact. The animal licked your skin, but by the time the animal was licking your skin, there was no part of you that had a cut or abrasion or the skin is peeled. Nothing like that. The waste from the animal was dumped on you, but not on the membrane, not through your nose, not your mouth, not your eyes, not on any open skin. If there is no deep bite, no deep escalation anywhere other than the animal just came around, licked you with your intact skin, and the waste didn't fall on any membrane, then there is no need for post-exposure prophylaxis. That is category 1. Category 2, you have the contact with the animal, either a bite or scratch, but no bleeding. You need post-exposure prophylaxis. Or you had the waste from the animal dumped on your eyes, mouth, nostrils, you need post-exposure prophylaxis. Category 3 is the same, mean bite, scratch, waste part being dumped on the membranes, but there is bleeding. No, the same thing happened in category 2, but no bleeding. Category 3, there's bleeding. The reason why we have difference between 2 and 3 is that when it comes to the use of immunoglobulin, some authorities will not use immunoglobulin in category 2 because they say no bleeding occurred. Why category 3, they will use immunoglobulin. Some will use immunoglobulin in either category 2 or category 3, but everybody agrees with category 1 that once there is no cut, no part of the skin is exposed, then you don't even need post-exposure prophylaxis. You've been exposed, and the suggestion is that there should be animal observation. So somebody has suggested that, okay, continue to observe the dog, or they ask you, now, how was the dog behaving? Was the dog mad? And your answer had been no, not mad. Or, okay, you go home and be observing the dog. Well, in the olden medical practice, in some places up to now, they still observe that. It is good to observe that the dog is behaving well or not, is mad or not. Even if that is the case, once you are suspecting that this could be rabies, or you are not sure of the immunization status of the animal that has bitten the fellow human being, then you just forget about observation, or the incidents occurred in the wild. Even if you were able to capture the animal or whatever, you just go ahead and treat fully. I mean, give post-exposure prophylaxis fully. Do you know why they always wait for 10 days? Signs and symptoms in animal may never manifest in dog in the first 10 days. That is the reason for the 10-day window that observation had always taken after dog bite. The incubation period in dog is between 2 to 8 weeks. Once the dog starts showing signs and symptoms, then that dog must die because there is no cure, and the brain can be examined, for rabies, infection, and that would be the gold standard in animals. You've been exposed, but luckily you've been vaccinated before. If that is your story, no immunoglobulin today. 0. We will go ahead and still give you vaccines, but instead of 4, you will take only 2, day 0 and day 3. However, even if you've been vaccinated before and your immunity is compromised now, we will treat you like someone without previous vaccination. If you choose to take the vaccines intradermally, then we will use the right deltoid 0.1 ml and left deltoid 0.1 ml on day 0, and we will repeat the same on day 3. You might not use deltoid area. You can use supraclavicular area or the thigh. Let's talk about rabies immunoglobulin in post-exposure prophylaxis. If the affected person is a known previously vaccinated person, no rabies immunoglobulin, no more. But if not previously vaccinated and not bleeding, some authorities will not give immunoglobulin. If not bleeding, but the bite occurs at the head, neck, face, or gluteal region, please give immunoglobulin. We must give immunoglobulin if the bite site is bleeding. Yes. After 7 days, getting to the 8th day post-bite, the effect of immunoglobulin is becoming less and lesser. If you are using equine immunoglobulin, then you need higher dose of that. Find out which one is available in the pharmacy. Find out from the pharmacist. In that case, you will need 40 international units per kilogram. If you are using human rabies immunoglobulin, you need a lower dose, half of what you need for equine immunoglobulin. In that case, it will be 20 international units per kilogram. When you have calculated the amount needed, we will divide the total into 2. Half will be administered at the site of the bite or scratch. It should be infiltrated into the wound directly. The remaining half will be administered at the gluteal region. And that is the only one that will be given at gluteal region when it comes to rabies prophylaxis. The vaccines must never be given at gluteal region. They can be administered at the deltoid, supraclavicular area, or the thigh. But immunoglobulin should be given two places only. Half at the site of the bite, half at the gluteal region. But if you are exposed to a situation where the area bitten by the animal is so large that infiltrating it with half of the dose calculated will appear inadequate, half a loaf will be better than none. We can dilute using ratio 1:1 of immunoglobulin to saline, or ratio 1 immunoglobulin to twice of the cell. Dilute, then use the entire new stuff you obtain now to infiltrate the site. Be ready for anaphylaxis or allergic reaction, although test dose is not what we usually do. If the animal is certified to be fully immunized, or the brain of the animal has been studied and deemed free of rabies virus, no immunoglobulin. We will not wait until we have obtained immunoglobulin before proceeding to give the remaining vaccines. It is still okay to give immunoglobulin second day, third day, up to the 7th day post-bite. Okay, you are done with the observation. Now, like dog or cat, you observe animal for 7 days, no rabies prophylactically unless the animal develops rabies. That is the teaching in some angles, but if you are dealing with wild animals like raccoons, skunk, wood dog, or foxes, then you start immunization immediately. Okay? If the dogs and cats are symptomatic, you kill and you examine the brain. Then you discontinue the vaccination when the result is back and the dog or the cat is negative for rabies virus. But I will not take the risk. I won't wait for all those things to happen. Once you've not been vaccinated before, and I'm not sure of the immunization status of the animal, then I'll go ahead with the vaccination. Vaccines could be given intramuscularly or intradermally. I will address that later on. And you select the type of vaccine that is acceptable in your jurisdiction. At what intervals? At what intervals? Because there are a lot of controversies, like I said, as part of the introduction in the beginning, that some wanted to give only one dose and forget about it. Here is the fact. Day 0, 3, 7, 14, 21, on 28, we need to give the vaccine. With or without immunoglobulin. Let me repeat. For immunocompetent victims, vaccine is expected to be given, if not previously vaccinated, on days 0, 3, 7, and 14. But If the victim, the person bitten by the rabid animal, or you're not sure of the vaccination status of the animal, is immunocompromised, then you give 5 doses on day 0, 3, 7, 14, and 21 or 28. It should be given at the territorial region for all adults and children greater than 2 years. You may go for anterolateral tie for children less than 2 years. Never give the vaccines at the gluteal region. The type of vaccine you are going to choose, you can go through the list I gave earlier, or contact the pharmacist or public health officer in your jurisdiction. Suppose that the victim is immunocompromised. Wow, we have a lot to do here. Number 1, we will take care of the wound like I have described earlier. Good. We will grab our immunoglobulin for all cases involving immunocompromised individuals. Either bleeding or not bleeding, we must give immunoglobulin. We will give all the doses of the vaccines. 5 will be given this time. Day 0, day 3, day 7, day 14, day 21, or day 28. We will report to whoever is handling the condition that has led to immune compromise, either diabetes, cancer, chemotherapy, uncertain medications like steroid, HIV, AIDS, and so on. We will check the rabies virus neutralizing antibody response titer. We will take sample for that in 2 weeks or a month after vaccination. If we are not doing well, as per the result of the antibody, we will give more doses of vaccines. We just don't want this person to be done with rabies. If not, it is not the immune condition that will kill him or her. The rabies virus will end the life. If the victim is in rural area, far away from health center, or transportation is a problem, then we have a way out. What are we going to do? We will still give 4 doses, but we will space the intervals. Day 0, 2 doses. 1 on the right deltoid, 1 on the left deltoid. Day 3, 0, don't come. We come back on day 7, 1 at any of the deltoid side, right or left. Day 14, don't worry. Day 21, another one at the other side. If you have given the day 7 on the right deltoid, I'll give day 21 on the left deltoid. Okay, let me point out some differences here. If the vaccine you are about to use can be given both intramuscularly and intradermally, you might be able to solve some problems with that. But some cannot be given intradermally. All of them can be given intramuscularly. So if you want to give intramuscularly, which majority will do, including myself, 1.0 ml will be the dose, okay? But if you choose intradermal route, you are going to give less, 0.1 ml intradermally. I will talk more about intradermal route. So with this, you are giving more vaccine, but here you are using less of the vaccine. So that is one difference. The dose, see, 1.0, 0.1. When you are giving the vaccine intradermally, please be sure you find blood, or else you might have given it inadvertently, subcutaneously, or intramuscularly. If what you have done is that, please, you have to give another dose. If not, 0.1 ml intramuscularly is not the same as 1.0 ml intramuscularly. They are not the same thing. Okay, you will be giving less if it is not truly intradermal, and you will know it is intradermal when you see the blood. If you are working in an environment where getting the vaccine is problematic, either because it is scarce or expensive, or because it's expensive, that is why it is scarce, then you can advise the government of the day to send to your region the anti-rabies vaccine that could be given intradermally. Why that? We will use low dose of a 0.1 ml per dose instead of 1.0 ml per dose for the I.M route. For the intradermal, it is 0.1 ml per dose. Even when you use right and left deltoid, you will use 0.2 ml in a day, unlike 1.0 ml per dose if you give it intramuscularly. So that is applicable where vaccine is scarce, because more people will be able to get from one vial than going by intramuscular. Even when it is expensive, one vial will cover many doses compared to intramuscular route. However, if you give these intradermally, if you don't see the blood, please don't deceive that man or woman, and he or she will come down with rabies later in life and die. Call him or her, let her know inadvertently you didn't plan it. You've given it subcutaneously or intramuscularly. In that case, you will give another dose intradermally, because 0.1 ml intradermal dose that has been given subcutaneously or intramuscularly is not good enough to save that life. If you are in malaria endemic region and the patient is already on chloroquine and you need to administer rabies vaccine, then go for intramuscular route on. We will not give anti-rabies vaccine in anyone taking chloroquine for malaria or for rheumatic diseases with intradermal route. No. Why that? The chloroquine will decrease the antibody response to intradermal anti-rabies vaccine. So it's like giving water. And that is why when the immunity is done, we will need extra dose like day 21 or 28. We've been talking about the vaccines for some minutes now. Let's go over possible side effects. At the site of the injection, there might be pain or redness, including swelling. That is, inflammation can occur. Then there might be itching. Then the systemic complications might include nausea, vomiting, headache, abdominal pain. Then there might be myalgia. Some will come down with dizziness. Then there might be fever, chills, or encephalitis. Some will develop severe allergic reactions. Some can have syncope. Others will have arthralgia, heals in some others. Then the brain could be in trouble. Besides the encephalitis, there might be meningitis, even encephalomyelitis. And unfortunately enough, some people can come down, with the end of life, death. Now, signs and symptoms. Incubation period. Usually 5 days to almost 2 years. But the common time that incubation period will last is 1 to 3 months. The prodrome time is around 0 to 10 days. Acute neurological period, 1 day to 7 days. Then coma in 5 to 14 days, and death. The differences between incubation period, the prodrome time, the onset of prodrome time to acute neurological period, and coma and the rest will be explained further. The incubation period is not fixed. And that is because we have so many factors that could determine the incubation period from 5 days to 2 years. The first I'm going to consider is the size of the bite or scratch. If this occurs at the head and neck region, it's going to be faster. Also the viral load, the variant, and then the concentration of the inoculum. If it is higher, the incubation period will be shorter. The host immunity is another strong factor. Depends on the immunity of the bitten animal or the human being that has been bitten. The presence of rabies virus neutralizing antibody IgG will confer some level of immunity. When we have that, the immunity of the host will be stronger than the person without it. Therefore, the incubation period will be longer. Certain cytokines, presence in the host immune system will also delay the onset of signs and symptoms, making the incubation period to be longer. For example, the presence of interferon, it's a form of cytokine, right? Will confer another immunity on the host. So the disease won't be able to become established. Previous vaccination will also disrupt the disease course. So all these will alter the incubation period. That is why we cannot find a fixed time to say the incubation period will be 5 days, 5 weeks, 5 months. No. Could be 5 days and it could be 2 years based on these factors. But commonly, the incubation period will be between 1 month to 3 months. Program. After the incubation period are passed, which will be 5 days to 2 years, mostly 1 month to 3 months, the virus will enter the peripheral nervous system either directly or by dividing the muscle or tissue where the virus had been deposited or inoculated. The virus will likely remain here for the entire period of the incubation, either 5 days or 2 years. When you carry out an investigation that time, you are not going to get any positive result. Even the virus may be there. Later on, the virus will then move centripetally to the peripheral nervous system. Their division will continue. Then signs and symptoms will start. And that will be the initial signs and symptoms. That is prodromal phase. The signs and symptoms here will start at the wound site, tingling, itching, burning, pain, or numbness. Then we'll be battling with flu-like symptoms, nausea, vomiting, diarrhea. Some will have cough, fever, fatigue, muscle pain, sore throat. At this stage, it is still non-specific. So the trouble has started, and some will start guessing what is actually going on, but may not guess that it is rabies yet. We are moving away from the prodromal phase that will be about 10 days to the neurological period that will take about 1 to 7 days. Okay, so at this time, we can be dealing with what is known as furious rabies or paralytic rabies. The furious rabies will be a kind of aggressive phase. Furious, now the English word, right? Here we can have restlessness, tachycardia, seizures, inability to sleep, insomnia, fasciculation, breathing fast, tachypnea, hyperactivity, anxiety, confusion, agitation, delirium. Then I will address some other things that are specific to rabies at this point. Hydrophobia. Hydrophobia here is that there will be spasm along the throat. So with that, mere thinking of swallowing or drinking water can even trigger that spasm. So the spasm and the associated pain would discourage the affected person from wanting to drink. So they can't drink easily, and they don't. Once they see the water, they'll be running away from it. It's not that they are scared of the water, but the fact that swallowing will become difficult. That is why they have hydrophobia. Aerophobia will also occur. That is, they will be afraid to face fresh air, okay? And they can run into lack of coordination. On top of this, they can develop hallucination. So the delirium and everything that will come with furious rabies or aggressive phase will be back and forth, meaning the furious rabies can have the time that it will abate, it will calm down, okay? If we are dealing with that, we call that episodic furious or furious episodes, and there will be calm in between the episodes. But what we're going to find when the episode comes back are those things I've listed earlier. Then we move to another part of it, which is the paralytic rabies. In this case, it's just about 20% of the presentation under neurological problems associated with rabies. Here, there can be fever, neck stiffness that we can misdiagnose as meningitis, and there may be headache and paralysis. The paralytic rabies will take longer course. Unlike the furious that is going to come, in form of episodic attacks, will come, everything rush, aggression, hallucination, seizures, everything will come fast. Then it will calm down and come back. In the case of paralytic, it will just continue like that, getting worse with time, right? It takes longer course, and just about 20% of cases. The muscle will become paralyzed gradually. The muscles that will first become paralyzed will be those ones around the site of bite, okay? And then will progress to generalized weakness of the entire body. In both cases, we can run into coma after. Coma will develop after, but it's going to be a gradual process and we'll get into coma. The coma will likely occur after 5 to 14 days. So we'll get into that troublesome juncture. Now, this is what we don't want, and that is why I'm making this presentation. Either prodromal phase progressing to furious or paralytic rabies, we'll get to coma. From coma, that will be getting worse and worse, then there'll be respiratory failure, there'll be cardiac failure, respiratory arrest, cardiac arrest, known as cardiorespiratory arrest. In that case, that is the end of the road. Death. Once the signs and symptoms are here, no more intervention. It's going to end up in death. Cardiorespiratory arrest. I'm not a specialist in animal issues, but for the purpose of this presentation, I will delve into this just once. This is not for people who had vaccinated their pets. You could see cats and dogs, right? But for those who have not, maybe you don't have the rules and regulations in your country to do. So watch out for this. Okay, in animals that have been bitten by other rabid dogs or other rabid animals from the wild, the prodromal and neurological stages will occur just as we found in human beings. But specifically, you can get the following when you observe your animals very well. There will be behavioral changes. Your pet, your dog, your cat has been known to be friendly. Suddenly will become aggressive. Or the pet has been known to be the slow walking, quiet type, suddenly becomes hyperactive. Or the other way around also. There will be hypersensitivity to light, to sound, to touch, and to movement. And because of that, they will be seeking quiet and dark places because they become hypersensitive to light. That is why they go for dark places, and hypersensitive to sound, then they'll be going for quiet places. Okay? Then there's an entity known as madness. This is what many people will see, and they will know that their dog or cat is now carrying rabies virus. And that is, the pet will attack just anything. Just anything. That's why people say mad dog. Just anything. Living and non-living. Running around. Barking and barking and attacking. Anything. That is the madness. Lastly, the bad news. You love your pet, but once we reach this stage, foaming in the mouth because of increased salivation. Remember, I have said earlier during pathogenesis and multiplication that the virus will reach the salivary glands. And it is from the saliva licking or biting and everything that they will transfer it to another animal or human beings. So, for me, at that point, I'm sorry, your pet must go. No, the animal must die. Then we will use the brain to test for rabies. Okay, let's get to the diagnosis now. First thing to consider here will be the history. History of a bite, scratch by dog, cat, bat, raccoon, ferret, and so on. Is it at home, domestic, or in the bush, wild animals? Is it in highly endemic regions for rabies? Did you notice the behavior of the dog? Like, was the dog mad? No, just tell me exactly what happened. Were you playing with the dog, or the dog ran to you just to bite you and ran away? Can you tell precisely which animal, if this is in the wild? Were you able to locate the animal, capture the animal, kill the animal? Or are you just arriving from a foreign country where rabies virus is prevalent? Then, of course, I will see the site. Is it head and neck region or your foot? No, hand, back. I want to see where. Then we'll embark on observation, but it depends on the region where this is occurring. I'll be comfortable to embark on observation in region with immunization policy that is enforced. And also when the owner of the pet has provided evidence that it's been fully immunized. In that case, we will agree that observation should be the next thing. So we'll start the observation. We'll observe for 10 days. If it is domestic animal, not stray dog. We'll observe for 10 days. Wild animals should be killed. And we will examine the brain for rabies virus. But if it is in a region where vaccination is not enforced and the owner is not cooperating, then I will ask, is the owner going to agree that we euthanize this animal and then check for rabies in the brain of the animal? So all those things should be in place. Outside that, we just go straight to post-exposure prophylaxis. Then we can rule out some differential diagnosis immediately. You could see that on this page, I'm not doing any tests yet. So could it be tetanus, cerebral malaria, typhoid, encephalitis, rickettsial, polio paralysis, and so on? We will rule out. Well, unfortunately, that would be in somebody already showing signs and symptoms. But that would be dangerous because once signs and symptoms are there, then death is at the door. Could it be alcohol intoxication, psychotic episodes, drug withdrawal, rabies, hysteria, flu, or porphyria will rule out all possible differential diagnoses, including Guillain-Barré syndrome, to rule out all this stuff. Okay, we are heading to the lab. We want to be sure it is rabies virus. We've gone past observation, killing the animal, the brain of the animal. Now let's get to the lab. Let's get saliva, skin biopsy, serum, CSF. Let me quickly address CSF. CSF is good, but it's not the gold standard. It's not the best here. Why that? Before we'll be able to pick the antibodies in CSF, it must have appeared in about 2 to 3 days in serum before it will appear in CSF. Also, the lumbar puncture might be cumbersome. There are so many rules guiding that. So not everybody could be grabbed and then you tap the CSF from the spine. So CSF is okay, but serum will be better if we're able to get the serum. Now, of course, anything that will make us get the CSF, we'll be able to get the serum. Now, the serum, we can use rapid fluorescent focus inhibition test. This to get what we're looking for. We are looking for antigen, antibody, and viral load. Skin biopsy. We can get the skin biopsy from the nape of the skin, fresh tissue, particularly around the region of the bile, and brain biopsy. All those, we can use that to get the rabies virus antigen using the gold standard method, direct immunofluorescence test for rabies virus antigen. That is the gold standard. Then we can get that when we pick the biopsy. The saliva also for all these items. So we can embark on mouse inoculation test. That is MIT, not Massachusetts Institute of Technology. That's not what we're talking about right now. Polymerase chain reaction test is also welcome and pretty fast also. Now, though direct immunofluorescence test for rabies virus antigen is the gold standard, but it is not all in all. It is specific, it is sensitive, but I said it is not all in all because sometimes we might get false negative. And why that? If we take the samples too soon into the infection, we might not get the correct one. Too close to the incubation time, or the animal is still, the condition is still in the incubation period, we might not get the correct answer. It might be negative. So let's have that at the back of our mind. Radiologically, only MRI, magnetic resonance imaging, will be helpful here. Treatment. Any treatment for rabies when signs and symptoms are already there? None. None. Someone asked me the question that, do I really need booster? Well, it's not everyone that will need booster, even if you are handling animals, and even if you need booster, not the same rate. Okay, let's get to that. Booster vaccination will be required pre-exposure or even post-exposure if you are a researcher producing rabies vaccines, you are a microbiologist working in laboratories dealing with rabies virus. In that case, you have one serum sample taken every 6 months. Then we will look at the titer. If it is anything below 1 to 5, or it is anything below 0.5 international unit per mil, then you will be given a booster. Secondly, you are veterinary personnel, either veterinary doctor, staff, animal handlers, wildlife officers. You are dealing with, the animals that could, have rabies. Then every 2 years, you have the titer acid. If it is below 0.5 international unit per mil or below 1 to 5 ratio, then you'll be given booster. Any other category of human beings don't really need booster. Prevention, prevention, prevention. We said everything about pre-exposure prophylaxis, also post-exposure prophylaxis. Now let's cap it all as per prevention. The goal is to prevent rabies infection, because once we have it, it is death sentence. We don't want the animal to bite us. Visit your veterinary clinic for vaccination if you are keeping one, please. Don't let your pet bite anyone, including yourself. Okay? Though you cannot vaccinate certain pets like guinea pigs against wild animals, but you can keep them in cage. That's it. I mean, let me explain what I meant by that. You have guinea pigs at home. It's not going to be on the list of animals to be vaccinated, even in the most controlled centers of the world. But the guinea pigs could be bitten by rabid animals. So if you don't want that to happen, keep your guinea pigs in the cage. Allow the appropriate authority about stray cats, stray dogs around you. Okay? Keep away from wild animals as much as you can. Hey, block the opening through which bats could get into your house. Vaccinate yourself if you are dealing with animals as a professional person, all right? All animal protectors, conservative officers should all be vaccinated. So wash the bite site, scratch area, wash them thoroughly with soap and water. Don't go home. Go to the clinic or emergency room if you have been bitten. Have you been vaccinated? Yes. Then you will take only 2 doses today. On day 0 and day 3, you come back for another one. Day 0, day 3, you take only 2 doses and that is it. You've been vaccinated? No. Then you will take either 4 doses or 5. If you are immunocompromised, you take 5. So make sure dogs are vaccinated, no stray dogs. Maybe I won't be going to the bush. I won't allow birds around me. If you've seen a dead bird, assume you've been bitten. If you see a scratch and you are camping in the bush, you don't know the animal, report your doctor. Aggressive animal, either in the wild or domestic, and the animal has attacked you, please go to the clinic immediately. I'm making this campaign because it is a senseless death. I am going to repeat this because my presentations will go around the world, even into some countries where they will not be able to afford the vaccine. I have addressed this. Please check my presentation again. You are far away from health center, there are stuff that could be done. Intradermal route and intramuscular route, you are taking antimalarial, there's no enough vaccine, you can buy more than 1 vial. Please review again. I have said everything. You are immunocompromised. That is not the end of the world. Review this presentation again. Now, in conclusion, if you look at this very well, I started from this slide, and I'm going to end here. This is a senseless death, killing close to 100% of infected individuals. Once signs and symptoms are showing in human being, you better write your will because in the next few days you'll be gone. There is no treatment. Prevention is cheaper than the incurable condition here. You know, they used to say prevention is cheaper than cure. In this case, it is incurable. Many people are afraid of HIV. They're afraid of this and that. They're afraid of hypertension, afraid of diabetes. You better be scared to the core. Rabies kills. Educate yourself and everyone around you, please. My brand is simply and solely to reduce pain, suffering, and preventable death, like death due to rabies infection. Thanks for listening. Please share this with everyone, like I've said here. Remember to subscribe to my channel because I will be publishing more and more of presentations like this to prevent pain, suffering, and preventable death. I appreciate your time.